I'm Dr. Judy Allen from the Mood Disorder Association Clinic, and I've been asked to talk about sleep hygiene. So you may wonder, what is sleep hygiene? And sleep hygiene are habits and practices that are conducive to sleeping well on a regular basis. Now, when people have mood and anxiety disorders, sleep disturbance is commonly part of those disorders, and the treatment for the disorders will eventually improve sleep. But proper sleep hygiene can be very helpful not to perpetuate the sleep problems while you're being treated. So, there are a number of points pertinent to sleep hygiene. One is to avoid caffeine and nicotine at night. You should also avoid alcohol at bedtime. Although people feel that alcohol will enhance their falling asleep, it is a powerful suppressant of rapid eye movement sleep, so people commonly wake up in the early morning hours and their sleep then is very disrupted. Exercise is excellent to help sleep, but not close to bedtime. So exercising early in the day can very much improve sleep. And people should keep a fairly strict sleep schedule, with getting up at the same time each and every day more important than when you actually go to bed. But the number of hours you spend in bed is important. You shouldn't spend any longer in bed than what you actually sleep. So for example, if you normally sleep 7 hours at night, you shouldn't be spending more than 7 or 7.5 hours in bed. The longer you spend in bed, the more disrupted your sleep will become. Do not nap. If you're having trouble with your sleep at night and you nap in the day, you can just subtract those hours of sleep in the day from the hours of sleep at night. And you should only go to bed when you actually feel sleepy. And bed should be reserved for the so-called 3 S's: sleep, sex, sickness. You shouldn't do anything else in bed. Now, if at any time you find yourself lying awake restlessly for over 20 minutes, you should get up out of bed, do something boring, and when you feel sleepy, you return to bed. And you can repeat that as necessary. But you should still get up at the same time in the morning as what you usually do. If you're having trouble with your sleep, don't watch the clock during the night. That will only make things worse. Some people find that developing some sort of pre-sleep rituals can help prepare them for sleep. So having a bath, perhaps having a light snack, doing meditation, sort of settling down from the day, will prepare both your body and mind for sleep. If you're prescribed any medications for sleep, they are meant to be taken at bedtime. Do not take sedating medications in the middle of the night, because they are meant to last longer than the time that you've allotted yourself in bed. Now, it's important to realize that individuals vary greatly in their own individual need for sleep. There are some people that seem to need only 4 or 6 hours of sleep at night, and these people are called healthy insomniacs. There are some people that seem to require 8 to 10 hours at night, but we certainly know that for people who regularly feel they need to sleep more than 9 hours at night, this can be associated with a number of health problems. On average, most adults probably sleep only about 7 hours at night. You also need to value your sleep. I meet many people who say that they're very sleepy in the day, and then I find out they're only giving themselves about 6 hours in bed at night because of family commitments, working multiple jobs, going to school, or by choice. If you're only going to give yourself 6 hours in bed at night, you will very likely be falling asleep during the day. So again, you need to give yourself adequate time in bed at night, but not too much that disrupts your sleep. So those are just some very simple but very effective habits to try to develop to generally improve your sleep. So, sweet dreams.